I have been a telehealth convert long before COVID forced it on everyone else, and have led large national telehealth provider networks, and across 50 states. I've like educated and taught people in the midst of COVID and CUs on how to deliver telehealth for behavioral health effectively and properly. And I am currently building now it's been almost 4 years, Fort Health, which is a pediatric telemental health company. So I'm in no way here to promote or sell anything about Fort Health, but really want to make this useful and practical for you guys. So I thought I would kind of walk through very real examples of what, from what I understand from this team, is some of the questions are like, okay, how do we, I'm going to share my like paltry little slides here briefly, and I will share them out in more depth afterwards. But how do we support kids in getting telehealth at school? And where is it not appropriate, and what kind of problems are presenting in real life? And I would love to hear any like feedback or questions from those of you on the ground who actually see what's happening here. From my perspective, like as a leader, a director, building programming, some of the like key factors, that practically that we think about is trying to fit in all the care that needs to be delivered after 4 p.m. to kids with humans who don't really want to work from 4 to 9 p.m. every single night of their life. It's really challenging to work with kids only in after school hours. Kids are at school all day. It does not mean that they have a safe and private place to access reliably where they can sit down for a full 45-minute or 55 minutes therapy session. It does not mean that they are working on things in therapy that are appropriate to be done in the middle of a school day. If they are working on things like trauma or more significant mental health concerns, the risk that you guys take on in managing that before and after is significant, I would imagine, and probably not very appealing to a lot of folks. And then there's just the logistics of like consent and accessing the platform and logging on to the visit, et cetera. But I also understand, like, I think that there are ways to think creatively about who could best access care. I think in particular, I think about kids with school avoidance or school-based anxiety, kids who get so stuck in the avoidance cycle that they are out of a school setting. And it's so critical for school professionals to be really, really well integrated into the treatment interventions and the plan moving forward. Because as we know, those kind of kids and those treatment plans can go sideways so quickly. But also, like, was one of the programs that we offer is a formal collaborative care program. So behavioral health care managers doing very brief interventions with families around skills and sort of skills coaching. And I think about all the ways in which a kid could benefit from brief check-ins with a case manager or a therapist around managing their anxiety before a test, or how to walk into the lunchroom and not be afraid of the social situation, or how to think about a conversation in free period or recess that was really difficult for a kid with social skills difficulties to navigate. If we think about like ways in which interventions that are briefer and lower risk and very much involving the school's collaboration, that's where I think things get really interesting. I also understand that you guys are eager and hungry for real examples of telehealth companies and offerings that are doing good clinical care the right way. And whether you are getting approached by folks like my team or other, whether it's on our podcasts, commercials, or it's on our social media feed, whatever it is, you're getting approached or learning about all like the influx, the flooding of virtual mental health care offerings and ways to access care. I thought I would spend most of my time kind of really walking through how I, as someone with a decade of experience here, go about navigating and vetting and putting my trust into companies that I do believe provide excellent clinical care, and then give you guys actual. I'll do that with examples of people you can refer to immediately. So this is. I want to make sure I'm watching my clock. So this is a loose sort of checklist of the top things that I look for. I'm going to share my screen to their websites in a second. But my number one question when I'm looking for is this company legit? Do I want to trust them? Is whether they are a specialty in kids and pediatrics or if that's just a general population that they treat. And oh yeah, kids are an afterthought. Like, oh yeah, we can scale down to 13, sure, no problem. That is a lot of what telehealth offerings are. And I think that is, we all on this call know that kids are not just smaller adults and they are true specialty, a true subspecialty. And when you bring in things like integrating school and consent and ROI, like across, various state lines, you really need to have an expertise in the team. And I am working with treatment programs that focus on kids. The next thing I'm going to look at is, can I see, this is all based on their websites, by the way. Can I see who's their clinical leadership is? I want to know, do I have visibility into their clinical team? Who is actually at the helm? And is it a real clinician who or a real clinical team whose kind of background and engagement and involvement is meaningful in the company rather than business folks leading clinical care. And then, what kind of clinical resources? I'm gonna switch over here. Sorry, let me work on what kind of clinical resources are being displayed by this company. I'm sorry, you guys, I have no idea how to get out of sharing mode anymore. Okay. What kind of clinical resources is this company sharing with the general population on their website that shows me, okay, they invest in evidence-based care, they invest in outcomes, they invest in educating folks, both parents and caregivers and fellow professionals or school-based mental health clinicians, pediatricians, et cetera. So let me give you, I have 3 folks I'm going to talk about who I refer to all the time that I want you to, at least if nothing else, leave with these 3 names in your mind. For eating disorder specialty care, that's all virtual and covered by most insurers in the state of New York and other states. Equip Health. Has anyone ever heard of Equip? Yeah. They are, let's see if I can show. Sorry, guys, I'm like rusty on my Zoom sharing. This is Equip Health, and they are all virtual care intensive eating disorder treatment. And they have developed very impressive clinical interventions, are in network with most insurance plans, and take care of some really sick kids, and now getting into the adult space. So I'm going to now go back on what I just said about needing to be only in the pediatric space. Some of these folks do flex into the adult space, but you can see that they're really the dedication to proper pediatric care and the specialty of pediatrics is a commitment of theirs. This company is a great example of one that makes a real effort to educate folks. Let's see, here we go. So why Equip? So I'm going to go here. I'm going to go to providers. And I'm going to see how, if I'm not an eating disorder specialist, how do I learn about what they can do and what I need to know as somebody who is within, a child or an adolescent's kind of world of caring adults. They do a great job of offering education, including free CEUs to anyone through their Equip Academy. And this shows me, that they are committed to they're committed to educating, and they're committed to like continuing to further the development of clinicians, not only on their own team of providers, but also within the general public. So I get a fair amount of actually CEUs from this organization. And it just very much does a nice job of walking through some of these very complicated and medically complex kind of uh, eating disorders and eating concerns that may present and may not be clear to folks who are not looking for them. So this is a great, like I said, EQUIP is a wonderful program, a trusted clinical intervention, and a very impressive model for doing pretty high risk and sick kids and young adults in an all virtual setting. The next an example of the next question I kind of look at is who is on their clinical leadership team? So here's the other one to learn, you guys. InStride Health. This is a all virtual insurance covered program for moderate to severe OCD and anxiety. So this, I have the advantage of actually knowing a lot of the leaders that are building these companies, my fellow clinical leaders in this space. But this company is doing amazing, really they really strong CBT and exposure response prevention for severe anxiety and OCD. And it really is like almost like a partial level of care, partial hospital level of care. They will a good partner will have a section that calls out how they work with schools. And this InStride does a great job of kind of really walking through how you can, as a school clinician, you can talk to the family or connect a family with one of these referrals. You may be able to help bridge care or at least introduce them to these strong care options. And then it talks about, how if a family consents, how they involve the school. And this company does a great job of school avoiding kids, and so involving the school team, working on exposures, working closely with the therapist is really is important. So this is a very impressive program with leadership out of Harvard and McLean. And this is a good example of when I look at who the clinical leaders are in a program. Now, again, full disclosure, these are my two friends. We trained together at McLean and at hospital in the Boston area. But they came out of the Harvard system, and they were doing this treatment program in Boston in the community. And COVID forced them to quickly pivot and go remote and virtual. And it was like they had to do it, right? And they discovered that actually their outcomes did not shift at all when they switched to virtual. And not all programs are going to be doing a good job of capturing and reporting on their outcomes, their treatment outcomes. These two, the InStride does an excellent job of that. And it's another example of like what you can look for on their website. This is their outcomes report. They make really visible and readable to the general public. A lot of websites will turn their kind of outcomes data into like marketing and sales kind of attempts. It'll look flashy. They'll make these claims, and when you dig in, it really is not very meaningful. Or it's like, oh yeah, people put a thumbs up after a visit, and that's like how we say that 99% of families find the care beneficial. No, okay, if you just write thumbs up or thumbs down, that's not exactly a valid tool that we would rely on as informed consumers of outcomes. But this InStride is a really good example of, I know that the print is tiny here, but it was a really good example of really how you can kind of look at the level of depth that they go into and the screeners that they use and the time period in which they measure treatment outcomes For a telehealth company, it's very difficult well, we all know this, it's difficult to capture outcomes and to consistently collect responses to measures. And they do a really strong job of that. Um, okay, I'm not trying to sell my company in any way, shape, or form, but I want to just call out another example of how I look at clinical leadership and kind of the foundation of skill and knowledge. Um, our Fort Health was built in partnership with the Child Mind Institute, which is a very well-regarded pediatric nonprofit for mental health. And so that kind of clinical partnership, other programs have other similar ones, really grounds the program in some sort of credibility and like foundation of solid clinical skill and commitment to evidence-based care and best practices and training. That if you're just kind of opening something on your own because you think that Jeff Bezos thinks that like healthcare is the next best thing to get into because anyone can navigate that and there's a lot of money there. There's a lot of that going on in telehealth and tech. And so looking for folks who maybe are built with true clinician leaders is one way to kind of assess. And on our resource page, again, this is just examples. The other companies have far superior resources than we do, I will admit. But we have a couple of, we do recordings of webinars for the general public. And um, here's two examples of our past webinars. And yes, I'm always on these things, but when we're talking about suicide prevention, we were able to get folks from the American Foundation for Suicide Prevention, from the JED Foundation. We are able to, this is why boys struggle in school, how to help. We had a leader from the Child Mind Institute, from Georgetown University. These are folks who these are clinical minds or, experts in their field, American Institute of Boys and Men. Frankly, I can't even remember exactly what that organization is because this was a couple of years ago. But it's people who are vetted and legitimate, gathered together in order to make this resource available to the general public and to consumers overall. And then Charlie Health, finally, is a company that does a great job, again, all virtual, um, a lot of insurance coverage. At least I will say that when I say insurance coverage, I'm speaking primarily on the commercial side first. And we all know that like Medicaid coverage gets a little more complex as you dig down. But all of these programs are doing like commendable efforts to work in network with commercial payers and some in Medicaid as well. But Charlie Health will do essentially an IOP level of care for people with a higher acuity or safety concerns. So, when we think about, again, they do treat adults, but they call out separately teens who are harder to treat in a more general telehealth kind of setting with self-harm or suicidality or substance use. They will treat that in a very like an intensive IOP level of care. So lots of group therapy, lots of individual therapy, family engagement, and then medication support as well. So this company, and again, I'm going to share slides that go through this and really encourage you guys, if you're interested, if this is helpful, to kind of look at these websites directly. But these are trusted like examples of folks who are really making amazing strides in changing how we think about what we can do in a virtual setting. And that doesn't necessarily mean that it can be done it's easily layered at school. But all of these programs are really committed to working closely with school providers to thinking flexibly and appropriately and responsibly about how we partner with our school settings. I will always opt out of trying to insert into a school setting for visits with kids. If there's any question about the appropriateness or whether it's whether it's the responsible thing to do, whether the school is comfortable with it, whether the kid is comfortable with it. But these are all, the clinical leadership across these companies, we get together regularly. We try and put our heads together around how we can help solve the problem overall. And people are thinking really creatively about how to help these really high need kiddos. And I know that that's something, these are populations that you guys face quite a bit. So let me just sort of pause and take a breath there. I would love to hear if there's questions or like specific, I don't know, what specific questions may be coming up in this area, and kind of thinking about what kids, like what a profile for an ideal kind of candidate for kind of school integration, or layering some of this outside treatment into the school setting. Like what are some ideal candidates for that?
First of all, Lindsay, I just want to say thank you so much for your presentation. And I really appreciate how thoughtfully you helped walk everyone through thinking about how to vet different programs. I think that's something that, at least in our work, we've heard from a lot of schools being really valuable to figure out because there's a lot out there. So I really appreciate that. And we do have time for some questions today. So I think I can put, or Lindsay, if you want to put those questions in the chat that you just were sharing, I think those are great ones. And we can ask some questions together. And then if we have time, we can also go into breakout rooms to reflect a little bit more. So thinking from the team, if there are specifically, if there are questions that you have for Lindsay around supporting students engaging in telehealth. And also, I think Lindsay had a great question about thinking about like the types of profiles of students of who is this appropriate for and what does that look like?